Dr. Andrea Maxim, naturopathic doctor and the creator of the Maxim movement, and we are continuing to discuss more about food sensitivities, and today we're talking all about how you can analyze and test to see if you actually have a true food sensitivity. And we've already discussed what the difference is between a food sensitivity and a food allergy, as well as exactly how the immune system responds in both cases. If you missed those videos, I encourage you to go back and look either in my YouTube channel or go back in your emails to make sure that you watch those. But as I said, today we're going to talk about exactly how you can identify if you do have a food sensitivity. Again, this is an immune response, a delayed immune response to a particular food, and this is an immune response that's coming directly from the digestive tract. So what naturopathic doctors are most known for is putting their patients on what's called a hypoallergenic diet. What we're actually doing here is we are restricting food intake of any particular food group that we think might be the culprit to some of your systemic or very localized symptoms. And it doesn't always have to be digestion, as we know. It could be headaches, it could be skin issues, it could be low energy, or it could even be something as simple as just gas and bloating. So if you know or suspect that there's a certain food that you think might be the trigger to these sensitivity reactions, then we encourage you to avoid them for a minimum of 4 weeks. It takes about 21 days for the immune system to finally calm down once you've stopped exposure completely and to regroup. Then what we do at the end of those 4 weeks is we re-challenge the body. And when we re-challenge the body, then it allows the immune system to mount a full-on immune response, because it does create sort of a memory response to that food. And then you know for sure, okay, when I'm exposed to gluten, I definitely flare up in a rash. Or when I have dairy, I immediately get a phlegm ball in my throat. Or when I have soy, my muscles ache or my joints ache. Or with arthritis, we often find nightshade vegetables cause a lot of joint pain, especially in the hands and wrists and feet. So this is your body's way of truly identifying, yes, this is a food that you should be avoiding. And with regards to healing, which is a big part that I find a lot of people miss out on, is they avoid the food, but they don't heal the gut. With regards to healing, you typically have to be avoiding that food 100% for, I encourage, a minimum of 3 months. And then over time, as your body heals, as your immune system gets stronger, you can start to reintroduce that food back in, and you may find that the immune response isn't nearly as strong. So if we break it down, we have the 4 R's of digestive health. One is to remove. So that's removing whatever the possible food trigger is. The most common food sensitivities, again, are eggs, dairy, gluten, but I'm finding soy in a lot of cases, and I'm also finding interesting ones like almonds or even fruits. So some people just can't break those foods down. Once we remove those foods, again, 100% diligently for 3 to 4 weeks, we can start the repair phase. And when we're repairing the gut, what we want to do is we want to calm down that inflammation. We want to bring those immune cells back together. We want the digestive tract to start functioning again. Once we're done repairing appropriately, then I encourage you to re-inoculate. When we re-inoculate the gut, that's when we add the probiotics. So often I find people add probiotics at the very beginning, but you have to think of probiotics like that final coat of paint. So if you have holes in your wall and you put a new coat of paint on it, all that's going to do is just make the wall look a little bit nicer, but the holes are still there. So you do need to take that little extra care and that little extra time to repair the gut lining, and that's going to repair those holes, patch them in, sand them down, and then add that final coat of paint. And that's when I encourage probiotics. And then we do the final stage, which is reintroduce. And when we reintroduce these foods back in, then you can identify, yes, I definitely have a reaction to this food, and you do need to avoid it for, at minimum, 3 months, 100%. So there are other testing that you can get done, and I have a few listed here. Heavy metals. So heavy metals very often cause a lowered immune response. They cause a lot of gut issues, and these are very persistent because it takes a long time to remove heavy metals from the system. Antioxidant testing we'd want to do. The IgG food allergy test. This is a blood test that you can get done, and you can get this completed by many labs in North America, and we'll go into an example of what a report would look like. A zinc tally test is also important for identifying if you directly are absorbing enough zinc or minerals in your body, and indirectly I sometimes use it to see if there's enough stomach acid. Live blood analysis, which is something that I personally do in my office to see exactly how healthy the red blood cells are. Is there any underlying infections present? Is there signs of leaky gut or large food particles in the blood? So on and so on. And then these other ones that I encourage you to get done through your medical doctors. CBC and differential, iron, vitamin B12, folic acid. You may want to do some genetic testing around that, like the MTHFR gene. Serum IgA, which we would specifically look at for celiac disease. Celiac disease also has a few other markers that we'll be touching on in a few minutes. Serum serotonin, tryptophan, so you want to be looking at how your neurotransmitters are functioning too, because they're very important and also travel through the gut, and the gut is a very important stage in that. So with the zinc tally test, this is something that can be done in office very quickly, and you're literally just putting 10 mils of zinc into your mouth, swirling it around on the tongue. If you have adequate amount of zinc, then immediately you should taste this really awful metallic taste. But if after the 10 seconds that zinc tally solution still continues to taste like water, then most likely, number one, directly your zinc status is low, and indirectly it could mean that your stomach acid is also low. I know I've discussed doing the betaine HCl challenge. However, I do find with a lot of patients it actually causes their stomach and indigestion symptoms to get worse, not necessarily better. So just be very cautious if you're doing any stomach acid capsules. The zinc tally test is a very safe and indirect way of measuring for low stomach acid. So with regards to directly testing for food sensitivities, this is an example of what a food sensitivity response could look like. And with most lab tests, what they're doing is they're measuring a marker called IgG. Again, remembering from our previous video, G is for gut. That's how we know that it's a delayed food sensitivity reaction. So what we're doing is we're actually measuring the number of IgG complexes for different foods. The larger the bar, the more of an immune response you have. As you can see here, this is someone who is incredibly reactive to all things dairy related. So for them, we would strongly encourage avoidance for 3 to 6 months and then slowly starting to reintroduce back into the diet. Here's another example of eggs, for instance, where they have a very strong sensitivity towards eggs, but other meats like beef, chicken, lamb, pork, and turkey are all fine and can be consumed as usual. And then, of course, wheats is another one. So we want to be looking at wheat, but we also want to be looking at variants of wheat. So spelt, walnut, whole wheat. And in this particular sample, we're seeing soybean to be incredibly reactive for this person. So 4 or higher, we call it a high or severe food sensitivity. 2 to 4 is typically moderate, and then 0 to 1 is very low. So really not something you have to worry about too much, but you may want to watch because over time your immune system response can change. If celiac disease is something you want to rule out, and remember celiac disease is an autoimmune disease where the body is actually being broken down with exposure to gluten and gluten-like molecules, we're looking at a marker called IgA. And when you do a celiac disease test, it's a very simple test that can be done through blood, and you can get this done with your medical doctor or a naturopath or another healthcare provider. And we're looking at how reactive or if these markers actually exist in your system. And there's 3 markers that you always need to get tested all at the same time: tissue transglutaminase IgA, gliadin IgA, and gliadin IgG. And this can help rule in or rule out celiac disease and differentiate celiac disease from just a severe gluten sensitivity, because there is a big difference here. And I've certainly had a patient where we were convinced it was celiac, but it was just that his sensitivity to gluten was so intense that it almost had the same type of presentation, but was not autoimmune in nature. So definitely this is also something you want to look into while you're thinking about the possibility of food sensitivities with regards to some of your symptoms. Now, what I personally do is a 7-day detox with my patients, which allows me to do all 4 steps of gut repair in less than a week. So what we do is we flood the body with high-dose nutrients using detox powders, and then we put you on a very restrictive diet of above-ground vegetables only, as well as herbs and spices, oils, but the powder is the key part. If you just go on above-ground vegetables for a week, you're just going to starve yourself and you're going to have a really horrible time. It's these detox powders that are going to ensure that you're getting enough protein, enough vitamins, enough minerals. And by doing that for what usually takes about 6 to 7 days, once you're all done, because your body has been so well nourished and you're finally getting all the nutrients your body needs, when you start to reintroduce all the foods back in, anything other than above ground vegetables, your immune system is pretty much on it. And what I encourage patients to do is to introduce these in mono-meal steps, meaning one food group at a time, separated by about 4 hours to allow that immune response to occur. Sometimes it can still be delayed by the next day or so, but for the most part, I've had patients identify exactly what their food triggers are pretty quickly. And this image that I'm showing is just an example of the module page that I send my patients to, where we have all the videos you need to walk you through how the detox goes. We have a number of different downloads, a number of different events or support groups that you can follow along with, especially our closed and very private Facebook group, just for those people that are doing the detox. And you also get an email from me every single day during it to make sure that you're following along and that the progress is going well. So that's one aspect of the 4 R's that I like to do in a much more elevated way, and this can also be found in my book, Maximized Health. So really, when it comes to testing, you can do this completely on your own by picking 1 or 2 food groups or a whole bunch all at once and avoiding them strictly for a minimum of 3 to 4 weeks, then re-challenging after that time. I do encourage that you take in some high-dose nutrients in order to heal the gut, and with regards to treatment, we'll be talking about that in the next video or next week if you're following along in your emails. But there's always more lab testing that you can get done. It's going to cost you a little bit more out of pocket, but it may give you more definitive results if you don't feel like doing 4 weeks of complete abstinence of certain foods. And then of course, if you want to team up with me or read about it in my book, my famous 7-day detox has shown to be very quick and very effective at identifying food sensitivities. As always, questions or concerns, and especially comments, let me know. Post it below this video or respond back to this email. And as always, have a happy and healthy day.